here in Outremont in Montreal. We're talking to various people who are involved in mental health projects.
My name's Picard. I'm a public health reporter at the Globe and Mail.
Okay, Andre, there's been, traditionally people have said the media have had quite a stigmatizing view of mental illness and had a role in perpetuating stigma. Could you tell us if you think this is the case or what your experience has been?
I think the media is very much like the general public. I think there's a lot of ignorance, a lot of just ignoring the issue. And, you know, we tend to focus on the bad things. When we covered mental health issues, it tended to be the worst of the worst. So people with psychiatric illnesses were violent, etc. So yeah, it did perpetuate, I think, a lot of stereotypes just by virtue of the fact of who we cover. But it's not just true of mental illness, it's true of everything. You know, you kind of cover the worst accountants and the worst stockbrokers, etc. So I think the media does perpetuate stereotypes in a lot of areas.
Do you think things are changing at the moment with regards to the media and mental illness?
I think there's been quite a dramatic shift. There's been a recognition in recent years that psychiatric illnesses are brain illnesses rather than something that you can, being brought up badly or whatever, or something you can control. So I think there's been sort of this sea change in an attitude that it's like any other illness, like a heart disease, this is a brain disease. So I think that's really dramatically shifted the way the media covers stuff, at least on the medical side, and I think that's starting to carry over now to the social side.
You've become quite renowned for being a very accurate and sympathetic portrayer of mental illness in the media. Can you tell me personally how come you came to this position as a journalist?
I think I tend to write about marginal things. So I started my career in healthcare writing about AIDS, and AIDS changed the whole way we cover healthcare. It became more social than medical, and I think that approach to me has always carried over, and it lends itself well to psychiatric illnesses, to mental illness. So to me, it's just sort of a natural extension of what I do. And the other thing I do differently is I tend to write about policy as opposed to medicine. So when you start writing about policy, you have to look at people, I think, much more than diseases. And when you do that, I think you have a very different view of what mental illness is.
Do you get much feedback from patients or family members or psychiatrists? People, I know at the end of your articles you have your email, I'm sure you get overwhelmed. What kind of things do people say to you?
Well, it's one of these areas where, because it's been forgotten, because it's been overlooked for so long, people are really appreciative. So I do get a tremendous amount of feedback. And a lot of it is very flattering, but the good thing about it is it brings people out of the closet. People are, they see somebody has shared their story and they're willing to do it. And that's broken down a lot of barriers. One of the hard things about writing about mental illness for a long time is that people were afraid to talk. They were afraid of, I don't want to be the crazy person in the Globe and Mail. So, once someone does it, there's a few brave people who broke the ice, it made it a lot easier to do it again.
I know you give workshops sometimes and you talk about how breast cancer used to be something that was stigmatized in the media and black people were always portrayed negatively. Could you talk a bit about that?
Well, I often tell the story that when I started writing about healthcare, my editors would say, well, we don't really want the word breast in the paper, that's a bit racy. And people, when you say that story today, they think that I was writing in the 17th century. But it's just an example of how attitudes change. Breast cancer used to be something that people would get diagnosed with very late. They'd have a tumor the size of a grapefruit, and they would die. It was sort of a shameful thing. You didn't talk about it. It was very, that was the end of your life once you got that diagnosis. With advances in medicine, that changed. We could diagnose this much earlier, we could intervene, and I see a parallel happening with mental illness. People there'd be a crisis, there'd be a suicide, there'd be a tragic footnote. And, now we can intervene early, people get better. The vast majority of people with mental illness get better, same as people with cancer. So I see these parallels, and I see there's no reason that it shouldn't be treated in exactly the same way in the media.
That's great, that's very rich. Thank you very much.
Okay. Great.